Good evening, everyone, and welcome to AARP Indiana's 2021 Virtual Volunteer Gathering and Awards Ceremony. I'm AARP Indiana State Director Sarah Waddle, and we are super excited to have you all join us for this special event. Every year, our volunteer teams from across the state come together to celebrate our accomplishments over the year and continue learning so that we can better serve the 50 plus communities that we live in. And for the second year in a row, we are in a virtual setting rather than being together in a room. But I think that the agenda that Dan has put together for us over the next couple of days is going to be great. And as a matter of fact, tonight we have a very special keynote panel that's going to feature three very stellar reporters. The panel is going to discuss the COVID-19 and long-term care issue that has been in front and center for us over the past almost 2 years. That's crazy to say. And so with us tonight, we have Kara Kinney of WRTV, Brock Turner of Indiana Public Media, and Bob Siegel of WTHR. We got to work with these folks quite a bit from the onset of the pandemic. And believe it or not, we still are engaging in these conversations. And, you know, from time to time, things are still coming up. So we're still connected with these folks. You know, as you are aware, AARP was very engaged in the nursing home crisis when it began back in March of 2020. And we still are very concerned about the staff and the residents of these facilities. We engaged in a lot of advocacy, and we discovered during this campaign that media is a very powerful outlet. And here I was at home working in my bedroom at my makeshift office, and we had these reporters calling us, and I'll be real honest, that was new for me. I got to develop that skill very quickly and jumped in the deep end, and these folks were very gracious to take it easy on me. But tonight the tables are turned. I get to ask you the questions, and boy, did I pick some hard ones. I'm gonna trip you up. No, not really. But we're very excited that you all are here. And for the folks that are at home, if you want to ask questions or make a comment, feel free to put questions in the comments section, and we will get to those at the end of our conversation. So, Kara, Brock, Bob, welcome, and thank you for joining us. Starting off, I'm going to start off with Bob. And can you tell us a little bit about what it was like at the onset of the pandemic as someone who was looking for answers and informing the public? What was it like?
Well, I think for all of us, you know, I think the word unprecedented is thrown around a lot, but I think it truly was a new experience for all of us. And the motion sensor, there we go. Motion sensor just went off in the room I'm in. Thank goodness for technology. I will definitely say that that allowed us to continue doing our jobs, but make no mistake, I mean, as an investigative reporter, to me, access is crucial to achieving accountability. And here we are in this unprecedented situation, and our access was severely limited. And I definitely understand when it comes to face-to-face getting together with folks in person, limiting that, you know, that was out of necessity. And I totally understand that. But I don't think that necessarily means that accessibility needs to be greatly diminished. And at least for me, I found that largely my access to be able to reach decision makers and public officials really was dramatically diminished due to the pandemic. So instead of, you know, showing up at someone's office to be able to get some answers, I had to rely on a phone call, and those folks were working from home just like I was. And if they didn't return my calls, I had little recourse to be able to get a hold of them and to get answers. So some public officials were very accommodating. Many were not. They were overwhelmed at the same time that the rest of us were overwhelmed at the beginning of the pandemic. So I'd say that my job, and I think I may be speaking for my colleagues as well, my ability to get answers and to hold decision makers accountable, it got a lot harder. So it meant reporting a lot more stories to make sure that public officials understood that simply by having reduced access and perhaps not getting back to us in a timely manner when it came to an issue like the nursing homes, where we were hearing from folks every day, in many cases every single hour, we would get emails and phone calls from folks really desperately wanting answers about what was going on with their loved ones inside nursing homes and not being able to get answers. It took us reporting over and over again, phone calls over and over again, emails, reaching out as constantly as we could, just to make sure that the folks at the nursing homes, public officials, understood that just because they weren't necessarily answering our questions or getting back to us, that didn't mean this story was going to go away and that we were not going to report on it.
I think, I coming from an advocacy organization that focuses a lot on, reaching out to decision makers. And I would say we would agree with you about access really being cut off, and having to come up with new and inventive ways to connect with our decision makers. And Bob, just for everybody out there, you're with WTHR, and that's in Indianapolis, because we are statewide. So I just want to make sure folks know where we're coming from.
Yep.
And Kara, I'm going to ask you the same question. What was it like at the onset? And, for somebody who was out there trying to inform the public about what was going on?
I would use the word chaos. It was very chaotic in the early days of the pandemic. We were getting so many emails and phone calls from loved ones, from people in nursing homes, from family members wanting to know what in the world was going on, because it's hard to imagine this now, but back then they weren't putting out information about how many cases were at each facility, and people were legitimately terrified to make a wrong move and put their loved one in a facility where there possibly could be an outbreak. People were dying, and we had no idea at which facilities these deaths were happening. So it was very chaotic in those early days and very frustrating and confusing for us as media and for families that were trying to basically get the right care for their loved ones with very little information. So we really relied on organizations like AARP. We talked to the state's long-term care ombudsman. We talked to nursing home workers, even if it was off the record. So when you don't get information, you will look to who will give you information. And I think that's sort of what we did in those early days when we weren't getting anywhere with the state. And even long-term care facilities, I think were kind of caught flat-footed in those early days and really didn't know what was going on, what to do, how to respond. So we just relied on organizations and groups and people that would be willing to talk to us.
Yep.
I would say,
go ahead, Brock. Go right ahead.
Yeah, I would say no one was really prepared for this type of an event. Like what Bob was saying with state access, no one at the state really had any idea of how to disseminate the information maybe that even we were asking for. And even if they did toward the later, 2 or 3 months in, there didn't really seem to be any incentive to do so. And I think it was that constant pressure from, media organizations, advocacy groups like AARP and others who had really, put pressure on the state to be more transparent on this front. But, and I think Kara hit the nail on the head. Like, facilities weren't, in a lot of cases, weren't giving this information either. They weren't giving information about how many residents of these facilities had COVID, where these residents were, what staff was doing to, mitigate virus transmission. And we didn't have information on even how dangerous this was. No one really had, information was a premium. And I think when folks began to see how little, people were disseminating, it was scary. And yeah, residents and family members were reaching out constantly saying that they didn't even know if there was COVID in their loved one's facility, let alone the facility down the block. So, I think there were a lot of red flags and a lot of, barriers put up. And yeah, everyone was, it's sort of, there's a balancing act there. Like, yeah, everyone wants to, think that people have good intentions and are overwhelmed at the beginning of a public health crisis. But I think there were also a lot of areas where the state and facilities, frankly, failed residents and families to not be more transparent.
Yeah, transparency seemed to be at the onset. I remember a press conference where Governor Holcomb, somebody asked him about facilities reporting, and he said, well, these are private businesses. They don't have to do that. And I just remember thinking, what is happening right now? But eventually the talk around getting more transparency, I know all of you talked about it. We talked about it. And ultimately it happened, but I'd be interested to hear what you think made the difference with the administration on getting them to report. And I will say, once they got the website up and running and updated regularly, it was a very good tool and they did a good job. It just took a while to convince them. So Brock, I'll start with you. What do you think? What did it take to press the state to do this, to share what was happening inside these facilities based on what the facilities were reporting?
I mean, I think that's the $1 million question. That's the question that I've been trying to get to the bottom of for a really long time, is what was finally that point that, happened internally that made the administration and FSSA and these other agencies shift. I've been filing records requests for months trying to find that answer, and I haven't been able to find it. So I think it would be premature for me to say definitively what that was. I certainly think media pressure and pressure from the public played some sort of role. I think it had to. But what specifically was that, that inflection point? I don't know that I could say with any definitive way until we get more data, which again kind of falls back to that transparency piece that we were talking about earlier.
Yeah. Bob, it looks like you're talking, but you're on mute.
Thanks. I think there were a couple of key turning points in all of this. When the state wisely decided that it needed to collect data so that it could track where the hotspots were and which nursing homes were having the most severe outbreaks of COVID-19. At that point, once they started collecting that data, then there's a very persuasive argument to be made under the state's public records law that if there's data that the state is collecting, the public access law says that that information should be made available to the public. And we know that for months, the state did not want to release that data. I think there was incredible partnership between the media, something that we don't often see. There's a lot of competition at times among different media outlets, but I think there was a common determination that this information, this was not about, despite what the governor and what the state health department was saying, this was not about protecting corporations. This was about protecting residents in nursing homes and getting information out to their families. So there was, I think, a coordinated effort. I remember talking to Kara during this pandemic, our frustration. We were going to be, and we did file complaints with the public access counselor. We got favorable responses from the public access counselor that this information should indeed be made public. We were able to point out that other states were making this information public. And ultimately, once CMS decided that it was going to mandate states to report this information, that was the watershed moment. At that point, the state of Indiana saw that they were going to be forced really to release this information publicly anyway. And at that point, I feel like they threw in the towel and decided we might as well go ahead and give the media and the public the information that they're looking for. But it took way, way too long. I'm really proud of the cooperation between, Indiana Public Media and the local television stations throughout the state and the newspapers. We were all asking the same questions. We were all getting the same questions from our viewers and our readers. And I think just continuing to pound away at that public access portion of it and that transparency portion of it is what eventually forced the state to realize it really didn't have any other choice.
Kara, anything to add to this?
Yeah, I agree that I would love to be the fly on the wall when that decision was made and know exactly what that turning point was. I'm sure that was a very big moment, but I think it was just a variety of factors. I don't know that it was any one thing, but I think being called out at weekly news conferences by different reporters and constantly being questioned. So I do think that basically being publicly called out at news conferences and on news stories. We did stories about the lack of transparency. We interviewed many people about the lack of answers. So I think not just us, but all the media outlets and organizations like yours speaking up about the lack of transparency. We also, and I know other media outlets did the same, we went so far to create our own database. We started collecting, because a lot of county health departments and long-term care providers, they were not down with what the state was doing. And they started giving us the information. So I'd call up, Hancock County, Shelby County. I mean, it was so tedious. We are putting together information for all these different county health departments and any provider that would give us the information, creating our own database and posting it online so that the public could have something to look at. So I think there was that, if the media can do this, why can't you as a state? And also, I think legal action. We filed a complaint with the public access counselor. I know Bob did, and I believe the Indy started, and I'm sure that played a role. And then we were very close to filing a lawsuit and had talked to other media outlets about doing that together and filing a lawsuit to get this information. So I think, we just sort of kept fighting and doing everything that we had at our disposal to get this information to the public.
It's pretty amazing what we can accomplish when we all kind of come together and have a common goal. Kara, I'm interested. Do you still think there's a problem with nursing home transparency today?
I definitely think there's always, room for improvement. I think that one of the things that we experience is that just a lot of nursing homes still don't want to talk about problems. And I know that's a question you plan to ask later is like, okay, what's next? But one of the biggest issues right now is staffing. I think it's something like 86% of nursing homes can't find the adequate staffing. That is a huge issue when it comes to caring for patients. And something I would want to know if I were putting my loved one in a facility is, what is the staffing situation? They can't find people to work. And when you're in a situation like that, that can be a life or death situation. So I think I just wish that nursing homes themselves would be a little bit more open to talking about these issues. I think people don't want to acknowledge that there's a problem because they don't want to be known as, the understaffed nursing home. So I just wish that they would be a little bit more forthcoming. And then the state, still has work to do in terms of providing records. We've fought for different records, and it's really difficult to get records in the state of Indiana. So just in general, not on nursing homes, but I think there's some improvement that needs to be made.
Bob, what about you? Do you think transparency is still an issue?
I do. I think getting real-time information from nursing homes is one of the biggest issues. There's still required reporting. The numbers tend to be reflected then after the fact. So for families who are looking for real-time information, they really need to rely on the nursing homes directly. So and having had loved ones who have been in nursing homes, I know one of the things that was always very helpful is we would ask for and usually get a personal number, a cell phone number for nursing home administrators, someone that we could trust in the nursing home, that if all else failed and we weren't able to get information or answers, someone we knew that we could turn to and not just be put on hold or not be able to get through. I absolutely agree with Kara. Staffing is really the next big issue, both COVID related and non-COVID related, when it comes to long-term care and nursing homes. There's just such a nationwide shortage of staff to be able to work in these facilities. So I would certainly be asking questions about the ratios and the staffing problems and talking to the staff themselves. We used to get most of our information about what was going on in the nursing home by talking to nursing staff who were on their breaks outside of the nursing home. So striking up those conversations, oftentimes it's hard to go through the direct channels because the administration has to be careful about what it says. So I would certainly advocate, when it comes to transparency, for nursing homes to be transparent. And I give a lot of credit. There are some nursing homes that have been fantastic. I don't want to, use a real broad brush here, but it's a really hard time to be in the long-term care industry right now. And unfortunately, I think the residents in these facilities are the ones who are really suffering because of it.
Yeah. And Brock, you kind of have a different, well, there's probably a lot of overlap, but being that you cover a lot of rural area, what is the message any different related to transparency? Are you still hearing things? Do you still think it's a problem across the state?
I think it really depends on facilities. I think Bob hit the nail on the head, and when he said, yeah, there are some facilities that do a really good job about being open. I know there was one group that had their own dashboard before the state even released its own. So I definitely think there are isolated companies and isolated facilities that have gone above and beyond. But I think, but just paint with a broad stroke, I think it's difficult because, yeah, there are bad, there are folks who aren't doing those things and who are not answering family members if they're calling, and keeping family, and we're keeping family members out even at the point when the state was requiring visitation. So I think there can be a really, I think it's difficult to say specifically, but yeah, I absolutely think transparency is still a difficulty, whether that's in urban facilities in certain neighborhoods or facilities where it's the only one of only one or two in the county. I don't know that it depends on any one thing, and there are specific facilities within the same group that maybe are better or worse than others. So I think it really depends with the state transparency. Yeah, I think there's always improvements that can be made. But yeah, when you compare Indiana to other states, I definitely think we were behind and lacked transparency compared to other states, especially with COVID data surrounding nursing homes.
There's some very interesting answers that resonate. just kind of thinking about the families, and you mentioned a lot of emails or, folks that you were talking to, family members, and we know that they were for a long time kind of just at a loss as to what to do. And so everybody kind of scrambled to get resources together. AARP put, sets of questions together that you should be asking these long-term care facilities. So after going through, kind of the initial phase of the pandemic and the nursing homes being hit really hard, what would you encourage families to ask these nursing homes, thinking about the future and what may end up happening again? It always could blow up again. And so what should we be telling family members to ask these facilities before they make a decision?
I'll go ahead and go. Obviously, ask about staffing. Ask for staffing to patient ratios. Ask about COVID cases. Ask how many cases they have. Check what they're telling you versus what's on the state's dashboard. Ask about their COVID protocols. What do they do if there's a case? Their isolation protocols. What are their testing procedures? Are they following testing of staff? That was a huge issue at the start of the pandemic. They were not testing nursing home staff. That was a huge development when they started requiring those rapid tests every time someone comes to work. Are they doing that? Ask about turnover. What's the turnover like? And try to hold them to specific data, because I feel like these are kind of things that you can kind of talk around, but ask for specific numbers. You can also look up inspection reports through the federal CMS, and I believe there's a state website as well. You can look up inspection reports. You can look up recent complaints. You really should do your due diligence, but those would be the things that I would be asking if I was putting a loved one in a facility right now.
Bob, Brock, anything to add to that? Kara sounds like she's talked about this before.
The one thing I might add is just the number of staff that have been vaccinated. I think that's something that, facilities a lot of times will talk around, and this isn't just exclusive to nursing homes. This is companies, hospitals, you name it. They'll a lot of times will talk around this and say, oh, well, we've required our employees to be vaccinated. But a lot of times that doesn't translate to the actual, gross number of employees that have been vaccinated. So I think that's an important distinction to make. And I'd echo everything Kara said. Those are all questions that I would be asking if I were putting a loved one in a facility right now.
Okay. Well, kind of just thinking about, I know you all talked to a lot of people and, put together some really heartbreaking but informative stories. And I'm curious to know, and I'll start with Bob, do you have a specific story or piece or experience, while you were covering the pandemic that you think was particularly important to the documentation of the nursing home crisis?
Yeah, there are a couple that come to mind very early on in the pandemic. This would have been in late March and in April when we first started hearing reports of some of the nursing homes. And I can think of one in particular in Johnson County, where the number of cases was really exploding. And then all of a sudden we started getting reports from loved ones saying, my father or grandfather passed away, and I've heard that, he was one of 12 or one of 15. And when we started to actually reach out and we were able to confirm that things were spiking, to me, that was kind of a wake-up call for us as journalists. And I think really around the country, it was a wake-up call about just how bad this pandemic could be getting, kind of foreshadowing what was about to happen. And I think obviously the nursing homes really took the brunt especially early on of those fatalities. So I think those early stories, I think, were pretty eye-opening. And then I remember each press conference, we were limited. We only got one shot a week to be able to talk to the state health commissioner and the governor. And then it was usually we each got one question if we even got called on at all. So we would listen to those, every one of those press conferences, and just kind of hang on every word. And there were so many questions that were asked about nursing homes. And I can remember the governor and the health commissioner saying, look, what's important here is that this information is getting to families. And ultimately, I agree. Those are the ones who had, I mean, the residents and the patients, they were the ones who desperately needed to know what was going on in these nursing homes. And the state tried to justify not releasing the data and the information widely by saying, we've put in a requirement that nursing homes have to be updating these families and have to be giving families information. And that's happening. Well, the reality was it wasn't happening. And I can remember stories that all of us would report day after day where we would, show the state health commissioner saying, families are getting this information. And then we've got a family saying, no, my loved one just died and I was never notified that there was an outbreak and how many cases there were. To me, those were really the memorable stories where we could just juxtapose what the state health officials were saying with the reality of what families were saying to show there might be good intentions here to get this information out, but it's not happening. And that's why we should really release this publicly and not just rely on trusting that somehow this notification was going to happen, which wasn't working the way it intended to.
Yeah. Brock, how about you? Anything specific stick out that really was an inflection point during this crisis?
There were a few, yeah. I would just echo what Bob was saying. Like, I don't think anything trumped and hearing individual families and folks who are, caring for loved ones in these facilities saying, I don't know, I can't get a hold of the facility, they're not being transparent with me. It's nothing replaces that. And I think that's just a level of disregard for fact that, really state officials should have and should continue to really chew on and think about, those policy decisions in the early days. The other things that I would stick out just from a purely transparency perspective, I had local health departments tell me they were informed by the state not to release data to the public and to media. So that kind of takes it another level. That takes it a step beyond just saying we're not going to release this data. We're going to, the state of Indiana told local health departments not to share this data that everyone was collecting, and I think that when you take it to that next level, it shows really, I think, a wrong and poor alignment of, what the state should be doing and whose interests they're valuing. So I think that was a huge point for me when I heard this, not just once, but a half dozen to a dozen times from a half dozen to a dozen different health departments saying the same thing. And to me, that was a huge point of just how significant this was and how widespread, and coordinated this effort was. That to me was really concerning, and still
actually. I remember that day, Brock. I remember when you asked that question, and I wrote your name down because I was like, "What is this guy? What is he saying?" And it was kind of a crazy realization that there was a lot going on just behind the scenes. But I remember that day. Kara, how about you? Anything specific stick out in your mind, story-wise?
Oh, yeah. I mean, it obviously all this is just like bringing up a lot of the memories. I mean, you kind of, not that you forget, but you just, you kind of have to move on. But, just thinking about, there were quite a few families that I interviewed back around May. There were a bunch of people that died at a nursing home facility in a rural part of our state. And I think the most heartbreaking part of that was they died in May 2020. And shortly after that, that is when the state came out with a testing plan for workers. That is when they came out with a plan for outdoor visitation. That's something we haven't really talked about yet, is just the mental health impact of COVID on all of these patients. And for months, they were stuck inside with no visitors. And we interviewed families that all three of them died in the same facility in the same month. And just that conversation with them about if they had just taken these measures sooner, would my loved ones still be alive? If they had COVID today, I can't remember when we talked to them. It was probably a month or two later. If they got COVID today, they would still be alive. So I think it's just that what if, and just that pain of knowing that, there have been many wonderful steps that have been taken, but for some people it's too late.
Yep, and that was kind of the message, that it was going to be too late, and the nursing homes, staffing wise, weren't keeping up with these phone calls that they were apparently sending out to all these loved ones. And it just, it was, a lot was hard to witness, and it was hard to talk about. And Kara, why we're kind of on this vein, I'm wondering, how has working on this issue of, the COVID in the nursing homes, how has it changed your perspective on people living in these facilities and nursing homes? And, is there anything that you look at differently now?
I think the biggest thing for me that has been a realization is that the way the general public still views people in nursing homes. I think that's been very heartbreaking. And I know that I've talked to you about this, Sarah, but people still have this attitude that if you're in a nursing home, you're on death's door, you're there to die. That's what people in nursing homes do. They're just, there to die. And as we know, we've covered, many, many families that people are there for rehab. People are there because they've got, an injury, they need to get better. Maybe they had a stroke and they are getting better. A lot of the people that died and a lot of the people that got really sick have a lot of years left and were only there for maybe a short stint, which was supposed to be a short stint at a facility. And so I think that it was just the sort of realization that when we did a lot of these stories, that still people would kind of discount long-term care deaths as like they didn't really matter. And I really felt like my job as a reporter was to make people care about these people. It was like, oh, it's the elderly. Oh, it's people in long-term care facilities. They were just going to die anyway. So I think that was like one of the biggest things for me, is that mindset that still exists and then trying to change it.
Yep. Bob, how about you?
I can remember back again to March and April of last year. And the first reports that I heard of deaths in nursing homes and outbreaks of deaths in nursing homes, when I contacted those facilities, I literally, two of them hung up on me when I identified who I was and said I was asking for some information and could they confirm some information. Others just flat out said, I'm not going to talk to you. It was about a week or two after that, and it was at one of the facilities that had the largest outbreaks in the state. I was expecting to have the phone slammed down on me. And I was told, well, I'll pass the information along, to the folks at our corporate office. We'll see if they'll call you back. I wasn't expecting much. I got a call back about 15 minutes later. And I mean, I get emotional still even thinking about this phone call. And here my mentality is, there's already 20 people dead at this nursing home, and clearly something is going wrong there, and someone needs to be held accountable for this. And I remember talking to one of the senior administrators in this company, and he just broke down in tears, talking to me, and he was so devastated. He knew the names of every one of those individuals, and he could tell me information about them. And it kind of opened my eyes up that I think there were some people and some individuals who may have maybe acted too slowly or perhaps made some wrong decisions, but there's really no bad guys in this situation. And he spent almost an hour on the phone with me, and he said, we need help. We didn't, we kind of knew what to expect, but we had no idea. And he was very frank. He was very open with me, shared a lot of information that I wouldn't have expected. And some of it that he shared with me was off the record. But it really opened my eyes up to, this tragedy. There's no bad guys involved here. There's a lot of people who I think were all really trying to accomplish the same thing, which was to take care of these residents and to do the best that they could. I feel that way with our state and our public officials on the county levels and on the state level. There were just different strategies and maybe different ideas on how to go about doing that. But I think it kind of opened my eyes up and gave me a different perspective and some compassion for just these decisions that these folks had to make every day and how they were going about their jobs. I would not want to be in their positions at all. It's a really tough situation. I know a lot of them took it really personally when they would lose one resident, let alone dozens of them.
It's a good perspective. Nice, Brock. I saw you're nodding your head too on that one. Anything with you, Brock, as far as a perspective change about nursing homes?
Yeah, I remember talking. I'd reported a lot. I had done, a lot of the state policy stuff. I sort of drilled down to the transparency piece, which I know we had talked about earlier. I'd written a lot about contact tracing at this point, and someone said, she said, we don't care about a source that I was talking to and had been talking to, relatively frequently throughout the pandemic, said, we don't really care about policy. We just want our personal situation to be better. We want to see our loved ones. We want to spend time with them. We want to be, we want to know that they're safe and getting, the best care and having the best quality of life possible. And I think for me, sometimes it was really easy to lose sight of who I was reporting for. And it wasn't going after some entity. It wasn't going after a corporate entity or the state or, anyone else like that. It was advocating for people that were there and who were isolated from loved ones, who didn't have, maybe at times weren't getting the best care or, were just scared. And I think that to me, that conversation to me really kind of shifted my focus away from really drilling down and trying to, unpack these policy debates and unpack, maybe inconsistencies with what people in power were saying, but rather refocus on the individuals who are, and adjust my aperture to the individuals who were in these facilities and living this every single day. So I think that to me was a big point where I just kind of, had to look at myself in the mirror and said, who am I doing these stories for?
Great perspective from all three of you on that one. What's next? What's and we kind of already touched base on this, I think you all talked about workforce, but maybe we can just dive a little bit deeper into that. What's next? What's the next big, story about nursing homes at this point? Because I think, if anything, attention that should have been on these facilities is there now. And I think that is a positive. We have a lot of conversations happening around, how we pay for our long-term care Medicaid in this state. We have lots of conversations around nursing home quality happening. But what's the next big story? Kira, do you want to go first on that one?
I mean, we really rely on families to help guide what the stories are. And so we are open to, story ideas. I mean, I really do think the staffing is going to be a big issue. Like I said, I believe it's something like 86% of long-term care facilities and like 77% of assisted living facilities, they can't find enough people. And this is a huge problem because, we're not getting any younger. I mean, so that's something that, we really are, not to tip my hand to my competitors, but, we're trying to find facilities to talk to us about this. And so I think, we would love to do a deeper dive into a facility and what they're dealing with and trying to find workers. So, and then other than that, we'll be looking for story ideas. So Sarah, if you guys have anything, but it's always on our radar. I mean, we will, I think, we know all of us kind of have a soft spot, and I know a lot more about nursing homes and long-term care than I ever did 2 years ago. I can tell you that. So I think they have a place in our heart, not to be super cheesy, but there's a special place in our hearts for the people that are in those facilities, and we will do whatever we can to make sure that people in Indiana are living their best life, if they're in one of these facilities.
Sarah, I'd argue that the next big story involving nursing homes is one that the nursing homes all over the country probably don't really want to be talking about very much. It's an issue that you and I have talked about. And that's the fact that while there's absolutely a place for nursing homes and they serve a really important role, the vast majority of Americans aging don't want to be in nursing homes. They want to be in their homes. They want their long-term care to come in a home setting, not in a facility. And that's something we looked at in our Gasping for Care documentary that we worked on here. And I feel so strongly that, and the state is now coming on board as well to kind of shifting how much money that we put into long-term care, how we kind of break that money up. And the vast majority of that has been going into nursing home care. And most other states are now putting a much bigger focus on trying to fund at-home long-term care, which is where most residents would rather be if given a choice. So I think that transition that the state is starting to reallocate funding to try to kind of balance out what right now is really top-heavy for funding that goes into nursing homes, and how to transfer a good portion of that into helping to fund care in individuals' homes more often. I think how that happens and being able to get the staff, I mean, the shortage of staff, both in nursing homes and in in-home care, how we manage that transition, and how aggressively the state is willing to listen to the preferences of Hoosiers who say we'd rather be, aging in our homes than in facilities, I think is going to be a really important story to cover here in the coming decade.
Yeah, I think just looking at how we deliver care, just to seniors and to folks that, are getting up there in years, I think that is absolutely the biggest story. It's something that I think about a lot. Like, what have we learned? What role does the private sector play? What role does the public sector play? Like, are these nursing home operators that are getting bigger and bigger by the minute and buying up, eating up the smaller fish and getting, are these large operators the answer? I don't know. But I think we've learned a lot, and I think we're going to learn even more as we look back on, the pandemic's not over by any stretch of the imagination, but the way that we, I think we'll learn so much about how facilities responded, how quickly they responded, and what the role of these facilities are in just senior care and as folks age. I know there's a lot of innovative things that are happening out there. We'll see what Indiana can do. But I think the market's going to deliver some solutions, but I also think policymakers have to be really mindful about how this space is regulated as well. I think all of those things are really important to keep an eye on as we come out of this.
Yep. And what I think is awesome is that Hoosiers can count on you folks and your colleagues across the state to give them that information, because as we all know, folks don't want to have to think about this stuff until they have to think about this stuff. But the more that we can be delivering them information so that they can start having these conversations with their families and their loved ones sooner and making plans. And, I think you're right. We have to be asking ourselves, down the road, if we, heaven forbid, have another pandemic, do we really need to have all of these people living so close together under one roof? And where most of them really don't necessarily want to be anyway. So lots of hard questions for sure, I think, coming down the pike. So how did I do as a question asker? Did I give you some hard ones? All right. I do see here that we have a couple of questions from Facebook about how, look at that. Isn't that cool? Eric here, public health for elders included incarcerated citizens in county and state prisons. Has the state of Indiana been forthcoming about our policies and practices, and how has COVID impacted these facilities? It was a big conversation that I remember listening to in those press conferences. Anything stick out to the three of you?
I think that state facilities, both local jails and state prisons, largely got overlooked. I think there was a lot of compassion for those in nursing homes, and I think there was less compassion for those who were incarcerated. So the transparency, from my perspective, was on a similar level from the state and from these these state facilities. We didn't get a lot of information from them. I know the state sent some of their strike teams in to try and address issues that were taking place in the prisons, but I think it's largely an overlooked and undercovered area. So it's a good question, and I think that those folks there are also extremely vulnerable, and during a pandemic, those are important stories to be telling as well.
I have a couple of colleagues who reported on that really in depth, and I think they were saying a lot of the same things Bob was, that this area was very undercovered, whether it's federal prisons with the Bureau of Prisons federally, or state prisons, or just local county jails. Transparency was not really present, and it was very difficult to get information. Obviously, it's probably just as difficult to connect with individuals inside those facilities, residing in those facilities. So yeah, I would just echo what Bob said. I think it's absolutely an undercovered area. But I think it's maybe a little bit, at least from my perspective, it's probably a little bit easier to cover nursing homes because I think there are more of them, and I feel like people are generally a little bit more willing to talk, whereas jails and state institutions like that, a lot of information, it's very difficult to get information out of those facilities.
Tough topics all around. Looks like we have another Facebook question that Dan's going to stick up here for us. Kim Adams, I want to personally thank all of you for your efforts and helping with this. I relied personally on WTHR, and I communicated frequently with them through private messages. Keep up with it. Change comes from bringing things to light. Absolutely, 100%. I think Kim just probably summed this conversation up for us. And I know that I am appreciative of you all being willing to always chat with AARP when we called, and kept us in mind when you thought maybe there were places we could help, and that you're willing to come together in a format like this, because it really helps advocacy organizations learn about the power of the media. And like I said before, we can do pretty great things when we all work together. So with that, before we go, I'll just offer you all a final statement. And Bob, we'll start with you and go to Brock and then close out with Kara. Oh, you're on
Advocacy.
Oh,
It's actually an honor for me, to do this with Brock and with Kara. I hope folks in Indiana understand and appreciate. Indiana's got a lot of journalists who really keep their nose down and are really serious about trying to hold individuals accountable and just to do the type of reporting that can lead to change. It is a great state to be an investigative journalist and a journalist in general, and there's a lot of media outlets here. My hat's off and kudos to all those who really pursued this transparency issue with nursing homes. I really think it was that combined effort of all the organizations working collectively and independently that resulted in transparency. Better late than ever.
Brock, how about you?
Yeah, I just want to echo what Bob said. It's such an honor to be on the panel with him and Kara. I think it really just shows, as that last comment said, when people come together around an issue, around something that doesn't feel right and is against a certain group of people that really has a hard time advocating for themselves in certain situations. I think there's a lot that can be done, and I think we'll continue to learn a lot about this pandemic as more reporting certainly is going to happen around this, but I just think it truly shows that, when people work together and when reporters are given a little bit of information and time to be able to look into these issues, really important stuff can happen and policy change can occur. And I just think that should make everyone feel good. It's really easy to get cynical, throughout this process, but I think these are sort of the moments where this job is worth it, and at least personally, this job is worth it, and good things can come from people banding together around something that they feel strongly about.
Yeah, there is a lot of angst toward the media right now, and I hope that is evident how much we really do care about the people that we serve. And I believe that we are public servants. And thank you so much to Bob and Brock and every journalist that covered this issue, and every journalist that was on those news conferences, like every single week. Like, I mean, the one or two times I got on to ask a question, sometimes my colleagues did it, my palms were sweating until they called on me, because I didn't want to be the person that didn't unmute myself, and I was worried I was going to have an audio problem. Like, it was super stressful. So props to every journalist, that got on for those, weekly news conferences and asked the tough questions, because it's much easier to just throw the softball. It's much harder to really ask the tough questions. So I appreciate all my colleagues in the news business. And I really appreciate organizations like AARP, because like we said, especially at that start of the pandemic, not a lot of people were talking to us. And so to have organizations like yours, sometimes people they'll send out a news release in an email. It is so crucial for us broadcasters, especially, to have someone to talk to. And I think it's really important that while an email is nice, a news release is nice, there is no substitution for hearing it from an actual person that's knowledgeable on that topic. So I just want to say thank you to the journalists who, hopefully did not get sweaty palms like I did when I had to ask the tough questions over those news conferences, and to organizations that were, always available to speak. And we appreciate it so much.
Well, with that, my dog is approving. With that, I just want to thank all of you for covering this and joining us today. And we look forward to working with you in the future. So thanks for joining, and have a great night, everyone.